Hi, welcome to Our Planet, Our Health. I'm Lori Byron, and I've been a pediatrician in Eastern Montana, caring for Montana kids for several decades now. Our Planet, Our Health is a local TV interview show that focuses on the effects of air pollution and climate change on human health. Most of the people we interview are healthcare providers, but sometimes they are not, because there are a lot of people outside of the healthcare industry that are doing a lot of action that actually improves our health. So with that away, today we have Livia Cole with us. She is a MSU Bozeman nursing student working here in Billings, at the Billings campus on her clinical nursing. She's in her 4th year of nursing. So welcome today.
Thank you.
So tell me about your childhood. Tell me about your parents and your family.
I probably had one of the best childhoods, if I'm going to be completely honest. I grew up about 40 minutes north of Boston and grew up on the coast and had 3 brothers and still have 3 brothers all over the place. One of them's in Missoula, one of them's in Boise, and then one of them's finishing high school back east. We all played hockey and we skied and we spent a lot of time outdoors. That was our big thing, which is really what got me interested in this sort of work, because I just think it's important to enjoy the outdoors, and it's such a special place. But yeah.
Yeah. What did your parents teach you that you're applying to your life right now as a nursing student?
My parents really taught work ethic and like drive and motivation. Both my parents are very hard workers, and nothing was ever handed to us. It was always like, you're gonna work to get what you want, and that really like instilled passion in me and still does. I'd say I'm a very hard worker, and I have a lot of motivation to do numerous things in my life, and that's definitely something that I got from growing up in a big family too. It was super easy, like it was nice to be competitive with each other, and that just constantly like drove each and every one of us to like be better at the sport we were playing, be better at school. Oh, like one of my brothers got this on an exam. Okay, I'm gonna do better than them on this exam. So yeah.
Plus you had to fight because you were the only girl, so
exactly.
You had to prove yourself as good or better, right?
Yep, 100%. It wasn't easy being the only girl, but I wouldn't want it any other way, because it really made me who I am and made me a strong, powerful woman in today's world, which we need. So
this is true. And in full disclosure, Livia is working very part-time for us with the Montana Health Professionals for Healthy Climate, helping us do some social media despite her hectic, chaotic, stressful last year of nursing school. So we really appreciate that, because you do a great job.
Thank you.
With it. So what did you learn from your brothers, besides trying to be better than them?
Always trying to be better than them. To not put up with any drama and to stick up for myself. And what else? I don't know. Yeah, just stick up for yourself, and that was a big thing. I mean, my brothers would always take care of me, and mostly I was taking care of them, but they would always check in, and most of the time just making sure like I was doing good. There was no one was like bullying me or anything like that. It was always, yeah. So
very good. So either in school or in your life outside of school when you're growing up, did climate change affect you at all?
Yeah, growing up, as I said, like the outdoors, we were always in the outdoors. It wasn't like, okay, watch a show until dinner's ready. It was go play outside until it's dark out, and then I'll call you inside for dinner. Like, be outside as much as possible. And growing up about 10 minutes from the New England coast, I slowly started to see things as we when I was younger, we got a lot of snow. We had great winters, and then it started to change to like nor'easters. We get crazy amounts of rain, snow, hail, a mixture of everything. And then on the coastline, some of the houses started going in the ocean, and like that was super eye-opening. And then during the summertime, there would be trash in the ocean, and just little things as little kids that you don't really realize what's actually going on. But now that I look back at it, that was the first time that I really saw like a change in our environment of, wow, like, do I really want to go swim in that ocean? Like, looks pretty gross. Or, wow, there's our neighbor's house just went in the ocean with that storm. Like, what's going on there? So yeah.
And to clarify for our audience that might not be totally immersed in climate change work, obviously there's been hurricanes, bad storms on the East Coast. There's been other sorts of extreme weather events for all of history. But what we see with climate change, we call it a threat multiplier, that it just makes these things more often, more and worse.
Yeah.
So
yeah, it definitely continued to get worse. And my grandparents are right on the coast, and we see it. It's like a great spot to storm watch from, but it's way more than it used to be. We used to get maybe one crazy storm a year, if that, and now we have like 3 in the summer and 3 in the winter. It's just nonstop. So yeah.
So what took you from the East Coast all the way out here?
The mountains and the open space and skiing, mountain biking, pretty much everything to do with the outdoors. I would like to say it was school, but school was like a second thought to me, and being outdoors was my first thought. Being on the East Coast, it's obviously a little bit more congested. Where I grew up, not so much, but I just was ready for a change. And although I love the ocean, I was ready to get to the mountains and be able to ski every day and hike every day. So yeah, that's really what brought me out here, the open space and the fresh air.
Well, you joined a crowd of people that had the same ideas, so that's great.
Yep.
And so you finished high school, and then how did you find your way into nursing school?
I finished high school, and I was on the route to do pre-med. I always knew I wanted to do something in the medical field. But I just wasn't sure what. For a while I said I wanted to be a doctor, and then I had a pretty big injury and took some time off of school, and just really wanted to be more of an advocate, and much more hands-on, and also realistically be done with school sooner than it would take to do med school at this point. So I changed to nursing school, and it's been a great decision, and I get to be hands-on with patients and learn and just constantly learn. I hopefully want to continue my education and do something like nurse practitioner or teaching of some sort, and be involved in not only climate work, but preventable health. And that's obviously one of the most important things that lies within healthcare is prevention, and so that's a big passion of mine. As I've gone through school and have been continuing to go through school, I just keep learning that, okay, well, you need to do this to prevent this from happening. And it's little things, but the little things add up and turn into big things. So if we can prevent that, then we have a lot less hospitalized patients and sick people in the world.
True. So climate change is a passion outside of your upcoming career. How does it relate to your career?
So I guess before I got connected with you guys, I never really thought of climate change being a big part of healthcare. It's easy to just go through the steps. We don't learn a lot about it in school. It's not really much like connection that's made in school with climate and healthcare, unless you're someone like me that makes that connection. And I think that our patients are continuing to get sicker and sicker and sicker, and that has a lot to do with the climate and the extreme heat, the extreme cold, the smoke, people just continuing to get asthma attacks, horrible, kids' air, all of our air, and it plays a big role in all the patients that we see, especially in the emergency setting. You have people coming in and they might not have an easy diagnosis, but a lot of the time it's because it's something more complicated, like an environmental factor. And so starting like from a public health standpoint, and looking at people's living environments, people's everyday activity, what their exercise looks like, all those different things. And it goes back to preventable health as well. And yeah, just.
Is there any aspect of effects of climate change and air pollution on human health that you've learned that really surprised you initially, that you think might surprise people in the audience?
I think heat is the big one, because growing up on the East Coast, our summers were always hot. And I just never really made the correlation between like the heat, and obviously the heat's gotten more and more extreme, but I never put two and two together and was like, our heat's like, it's getting hotter and hotter, and people are continuing to like have more effects from heat strokes, heat related illnesses of any sort. So yeah, I think the data that's come out on babies and fetuses has, with the heat, has been super concerning. Something that we never really thought about before, that moms being exposed in pregnancy, that it affects the fetus to where they're more likely to be born small for gestational age or preterm. Totally.
Yeah, we just don't even think about that. So when I was in medical school, social determinants of health did not exist. Now, it was obvious to those of us that worked in rural areas or with poorer populations that it was obvious that there were things that affected our health outside of the exam room. But it wasn't something that was taught in school. And you probably have a lot more of that now. And I'm wondering if you could explain how some of these social determinants of health also kind of affect the way we're affected by climate change and air pollution.
Yeah. I think...
Maybe explain what SDOH is first.
Yeah, so social determinants of health, gosh, I'm learning so much about it in school. I should have like a perfect definition. But basically all of your like living environmental factors that play a role in your access to healthcare. Now I'm going to blank, of course. Yeah, I'd say mainly like access to healthcare, environmental factors like I talked about. So like a big one that I think about is just rural places not having adequate access to healthcare, and not having things like heating or air conditioning. And so if you don't have access to that and there's extreme heat, then you're at a much higher risk for heat-related illness with no air conditioning. And especially like this past summer was crazy with the heat. And there were so many people that were coming into emergency departments with heat illnesses because of they couldn't maintain a steady body temperature because of how hot it was and having no air conditioning. So I think like especially the homeless population, that's a big thing, like, and not having access to the proper things that you need to maintain your life and live. Yeah.
So it's basically a vulnerability.
Yeah.
Right? Yeah. Okay. So a lot of people think that climate change affects people in Africa, and maybe it'll affect us in the future. What would you have to say to that?
I think it affects people everywhere, and what is local is worldwide, essentially. it's happening everywhere, and it's not just in one localized spot. Yeah, some places might have more wildfires, such as Montana, than East Coast places, but East Coast places are definitely, I remember my senior year of high school, there was a massive wildfire in Canada. That was the first time as a kid that I saw wildfire smoke, and I was like, what is going on? But now that's a normal for them as well, which is crazy. It's affecting people everywhere.
Yeah. And when you had that smoke from Canada in where you were, was it significant enough that when you went outside you felt it?
Yeah.
Do you remember how you felt?
Yeah. I felt claustrophobic. I was like, I feel like, I don't know, you just feel so, I don't even know the words for it, but claustrophobic, yeah.
Wow, that's a great description.
Yeah.
Did it affect your ability to be outside?
100%. I was a runner. I ran cross country in high school. I played lacrosse as well, and so a lot of outdoor activities, and we had sports practices canceled, and that was really the first like rude awakening of what is going on here. Like, this has never happened before.
Yeah. So what do you, there's a lot of people that think that they just as soon bury unpleasant ideas under the rug and ignore them. And for a lot of people, they feel like there's nothing they can do that's impactful related to climate change. What would you have to say about that?
I think that even as busy as I am right now, the social media work that I'm doing with you guys and just putting stuff out there that in simple terms that make sense to everyone, and just awareness of what's going on, and trying to volunteer, trying to do different, like we did the Ride for Their Lives, like different things to create awareness. I think that's the biggest thing right now, because there's a lot of people still who have no clue what's going on, and are very oblivious to the fact that like, the climate is imposing a big risk on all of our health. And yeah, it doesn't matter who you are or where you live. So
you want to tell people what Ride for Their Lives is?
Yeah, Ride for Their Lives is a ride that you'll have to remind me of the sponsors that do it.
Billings TrailNet and
the Children's Clinic.
Riverstone, Billings Clinic this year.
Yep. And so it's a bike ride that we put on that is, how many miles? Goodness,
20.
now I'm forgetting. 20 miles. I did it, so I should know this. And anyone can sign up. We start all the way on the west end and then come down to the Children's Clinic here, and it's just to promote awareness for creating a healthy environment for our children, and clean air. We've had a few years, I think, was it last year that they had to cancel it because of the air quality was so bad?
I think last year we were worried about it, but it ended up being clear enough to be safe.
So we've even had some years that we've had to postpone because of air quality, which is that much crazier. We're trying to promote an event for healthy, clean air, and yet we can't even do it because it's the air quality is so unsafe. But yeah, it's a really great event and gets a lot of people in the community involved, especially health providers, but also kids and community members of any sort that all ride together.
Yeah. So why do you think nurses should care about air pollution and climate change?
I think that, I've said it a few times now, but with different illnesses that we're seeing, a lot of the illnesses are related to the environment and environmental factors that either people have in their homes or people are living every day around, that they might not even know that something next to them, like a refinery, is causing pollution and effects on their health, but yet then they come into the emergency department with multiple conditions, and a lot of the times the root causes are those environmental factors, and it's just affecting the different types of patients we see, and we have to be more aware of it. Because of that, it might not be like a straightforward, easy diagnosis of, oh, this person has a broken leg or something like that. It might be they have an asthma exacerbation because of the air quality that's happening right now, or they're having a heat stroke because they've been working outside all day and their body can't take it. Yeah.
So when you become a real nurse, I remember those days, before we were a real doctor, what sorts of things can you advise patients about that would help protect their health that's related to air pollution and climate change? What can you do besides just say, oh, this worsened your asthma? Is there any advice you can give?
Yeah, being aware, which is obviously what we're trying to do, is create awareness that these things are actually happening. And knowing like strategies such as on a really hot day, you need to hydrate, and maybe taking a cold towel and putting it on your forehead, finding shade if you don't have a home to go back to, or if you don't have air conditioning, closing all your shades in your house. I know my house this past summer was ridiculously hot and I don't have air conditioning, so I would open the windows late at night, but then early in the morning I'd close them and close all the shades and try and capture some of that cool air. And knowing like where to find reliable resources of, they have great wildfire smoke detection maps. So if the wildfire smoke is impending on your area that you're living in, then make sure you close your windows, wear a mask. Especially, I mean, any healthy person should, but especially if you're affected by asthma or COPD, different lung breathing problems that affect it that much more.
Yeah. And so I know you've just been doing a public health rotation, and the public health departments also typically related to that within the government of a community is things like emergency response and disaster preparedness, those sorts of things. So on a not individual scale, but a community scale, are there things that some communities do to help prepare for these sorts of situations?
I think yes, but it definitely needs to be done more. There's definitely a lack of that. I mean, we have so much, there's not enough people in healthcare in general that then to have people figuring out disaster preparedness and preparation for that. It's really difficult when you're trying to do what's on your mind that day it's just hard to prepare when you're so overwhelmed by all the other things that are going on in your job and all the other patients that you're trying to treat. So it's really difficult. I will say that in my rotation, my public health rotation, we talked a little bit about that, and we reviewed different scenarios that had happened, and looking at that and seeing how do we prevent this, what do we need to do in the community to educate, to make things, to close the gap on that and be more prepared for next time, or hopefully prevent it all in one.
So we like to end our program each time with you having a minute to tell the audience if there's options that they can do besides sweep things under the rug. What would you like to tell the audience?
Get involved in your local community, and find other intelligent people that have a passion for things like this, such as Montana Health Professionals for a Healthy Climate. And learn. I'd say the biggest thing is learning about it too, and then taking the steps to prevent or minimalize climate change. But yeah, I'd say really just advocating for our kids and knowing that it's only going to continue to affect us, and learn about it. Yeah.
Yeah. And I'll put in a plug for the Ride for Our Lives was part of the Billings Climate Coalition, and you can go to the Billings Climate Coalition online. It's named that for the website, and they have activities throughout the year. A lot of them are educating, making ourselves aware. So
yeah, and we have Instagram, Facebook, Blue Sky, and LinkedIn, and we do a pretty good job of keeping that all up to date with different information that we see. We try and keep it local to Montana, but sometimes there's other stuff that's in the news that is very important to talk about. And yeah, just educating.
Good deal. You do a very good job at keeping that up to date. So thank you for all the work that you're doing outside of the work you're doing to become a great future nurse. So thank you.
Thank you.